Hello friends, welcome to Algen Institute of Physiotherapy. Today we are going to discuss about stretching. So in stretching, we'll discuss the definition and basic key terms or terms related with the stretching maneuver or stretching technique. So let's start with definition. It is a general terms. What mean by the stretching? So stretching that means you are elongating, you are extending the structures that have adaptively shortened because of any pathological reason or because of any higher center lesions, and you are extending or you are elongating the structures that have become a hypermobile over a time. So here we have a definition. It is a general term used to describe any therapeutic maneuver designed to increase the extensibility of soft tissues, thereby improving flexibility by elongating structures that have adaptively shortened and have become hypermobile over time. So here we have a terms mobility. So what mean by the mobility or mobility that means movement or motion, that motion during the task or during any function. So this word is described based on two different but interrelated parameters, that is the functional range of motion and functional mobility. What mean by the functional range of motion? The ability of structures or segments of the body to move for functional activities, means for your functional task. Next is functional mobility, the ability of an individual to initiate, control, or sustain active movements of the body to perform simple to complex motor skills. Next is flexibility. Flexibility that means your ability to move your body parts or ability to move your body. So here we have a perfect definition. We can define this flexibility. It is the ability to move a single joint or series of joints smoothly and easily through an unrestricted and pain-free range of motion. So we can divide this flexibility and again too there is a dynamic flexibility that referred to as a active mobility or active range of motion that done by or that can perform by a patients, and it is degree to which an active muscle contraction moves the body segment through the available range of motion of a joint. Next is passive flexibility that refer to a passive mobility or passive range of motion is the degree to which joint can be passively moved through the available range of motion and is dependent on the extensibility of muscles and connective tissues that cross and surround a joint. Next is hypermobility. Say hypo is a prefix word and mobility that means the motion. Hypos that means hypomobility that literally means something is reduced motion or decrease motion or decrease movement. So it refers to a decreased mobility or motion. A wide range of pathological process can restrict the movement and impair mobility. These are the many factors that may contribute the hypomobility and stiffness of soft tissues, the potential of loss of range of motion, and the development of contractures. So factors that contribute to the restricted motion, first is the prolonged immobilization. In prolonged immobilization, we can divide the because of the extrinsic factor and intrinsic factor. So extrinsic factors like the cast, splints, and skeletal tractions. Intrinsic factors like the pain, joint inflammation, effusion, muscle tendon, facial disorders, skin disorders, body blocks, vascular disorders. Sedentary lifestyles and habitual faulty or asymmetry postures can also lead to hypomobility. Paralysis and tonal abnormalities and muscle imbalances, uh, it can also lead to hypomobility, postural malalignment, congenital or acquired. For example, is scoliosis. Next is contracture. It is adaptive shortening. So what mean by the contracture? It is adaptive shortening of the muscle tendon unit and other soft tissue that cross or surround a joint that results in significant resistance to passive or active stretch and limitation of range of motion, and it may compromise the functional abilities. And this contracture we can divide in mainly of four types: myostatic, pseudomyastriatic, arthrogenic and periarticular, fibrotic contracture and irreversible contracture. Let's start with the myostatic contracture. In myostatic contracture, a significant loss of range of motion, no specific pathological present. So no specific pathology is present in myostatic contraction, but the muscular tendons and unit has adaptively shortened, and this type of contracture is resolved with the relatively short time with the stretching exercise or stretching maneuver. Next is pseudomyastriatic contracture. This causes the impaired mobility and limited range of motion. Hypertonicity, that means the spasticity or rigidity associated with a central nervous system lesion such as a cerebral vascular accident, a spinal cord injury or traumatic brain injury, that can lead to this pseudomyostatic contracture, muscle spasm or guarding and pain. In the both situation, they involve the muscles appear to be in a constant state of contraction and the giving rise to excessive resistance to passive stretch. If inhibition procedure to reduce the muscle tension temporarily are applied, so full passive elongation of the apparently shortened muscles is then possible. Next is arthrogenic and periarticular contractures. Causes of this: the arthrogenic contractures, any intra-articular pathology which may lead to include adhesion, synovial proliferation, joint effusion, irregularities in articular cartilage or osteophyte formation. Then periarticular contractures, causes of this: it develops when the connective tissue that cross or attach to a joint or the joint capsules lose mobility, thus restricting the normal arthrokinematic motion. Fibrotic contracture and irreversible contracture. So fibrous changes in the connective tissue of the muscle and periarticular structures can cause the adherence of these tissues and subsequent development of fibrotic contractures. And these changes can occur after long period of immobilization, and it is possible to stretch a fibrotic contracture and uh, even actually increase range of motion, and it is often difficult to re-establish optimal tissue length. So here we'll end the today's lecture. So thank you.